Now we're going to see the abdominal organs that can be injured and the associations with the injuries, or when and how we need to suspect injury to a specific abdominal organ. We will talk about the spleen, liver, duodenum, kidney, and pancreas. So the spleen would be damaged usually if there is involvement of the 9 to 11 ribs. This is the most common abdominal organ damage in blunt abdominal trauma. And remember that whenever we do the splenectomy, we need to vaccinate usually 2 weeks after against Neisseria, pneumococcus pneumonia, Streptococcus pneumonia, and Haemophilus influenza, because these are the encapsulated organisms. Remember that for spleen rupture we have degrees. We have low-grade injury and high-grade injury. The low-grade injury is from 1 to 3, low, and high-grade injury is 4 and 5. Here we have just 10%, well, less than 10% of the surface area, 2 between 10 and 50%, 3 more than 50%, and 4 involvement of the hilar and segmental vessels, and 5 is shattered spleen. So whenever we have a hemodynamically stable patient with low-grade injury, we can do just monitoring the hemoglobin, sometimes surgical laparotomy, and in some cases surgical repair. This would be the best scenario. The next is if the patient is hemodynamically unstable. If the patient is hemodynamically unstable, we will do surgical laparotomy. And if the patient has high-grade injury, we will do surgical repair or exploratory laparotomy or splenectomy. And remember that in the splenectomy we need to vaccinate the patient. Now, the liver could be the most common injury organ when there is right rib involvement or right side. And we will see certainly these two with a positive fast focus assessment of abdominal sonogram for trauma. So we will see fluid on the peritoneal cavity. The duodenum would be, or we should suspect this in retroperitoneal free air on a X-ray. We need to look for this. This is damaged when there is compression to the adjacent spinal cord over to the spine. And we should suspect this in a child that falls in the handler of a bike, for example. Now, the duodenum injury presents with epigastric pain and venous hematemesis. The kidneys do not regenerate, so the important here in the kidney is that we need to try to save the kidney as much as possible, because the kidney does not regenerate. For example, liver can regenerate, kidneys don't. And the pancreatic injury, we would suspect this if the patient has the seat belt sign, like a little of hemorrhage around the seat belt. And if the patient has the blunt abdominal trauma plus persistent pain or tenderness in the abdomen, persistent nausea or hematemesis, increased amylase in serial measurements, or a peripancreatic fluid collection. This peripancreatic fluid collection indicates rupture of the pancreatic duct. And the management for a low-grade injury could be non-operatively, but most of the cases requires the surgical repair. And lastly, the diaphragm. The diaphragm could be damaged. It could be in a blunt abdominal trauma in case that we are increasing the pressure, and so the pressure increases or pushes the diaphragm upwards and so can rupture it. Most commonly on the left side, because the right hemidiaphragm is protected by the liver. So now the patient could present with herniation of abdominal organs on the thoracic cavity, and these would present as entrapment of the stomach or small bowel, and so the patient could have signs of obstruction, of bowel obstruction like nausea, hematemesis, etc. The treatment here would be surgical repair of the abdominal organs. Usually we would do a laparoscopy, but remember that the gas insufflation can complicate the care of anesthesia. So that is, we have spleen and liver are the most common abdominal organs that are damaged on blunt abdominal trauma, and they would give us a fast positive. The pancreas should be suspected on increased amylase, persistent pain, tenderness, nausea, hematemesis, or prepancreatic fluid collection. The diaphragmatic rupture, we will see it on a X-ray as elimination of abdominal content into the thoracic cavity. And the duodenum injury, we should suspect it if we have a patient, usually a child, with a duodenum hematoma that results from the fall that ends up on the side of the spine and onto the handler of the bike.